From KETK, you're watching East Texas Live.
Welcome back. June is Men's Health Month, and joining me now is Dr. Armstrong, a board-certified urologist with UT Health East Texas. And today we're focusing on a condition that affects millions of men but often goes undiagnosed or untreated. It's called an enlarged prostate. Thank you so much for joining us today.
Thank you for having me. It's great to be here to discuss such an important issue and to raise awareness.
Yes, sir. So let's talk with the basics. So what is BPH?
Sure. So BPH stands for benign prostate hyperplasia, which is non-cancerous enlargement of the prostate. And this happens naturally over time as the prostate grows. Sometimes it compresses the urethra, and in many men that can lead to certain symptoms that develop over time. Some of those include going to the bathroom more frequently, or feeling like their flow is slowing down, or not emptying the bladder, or feeling like when they go, they're not getting everything out.
Yes, sir. And so why should men start kind of paying attention to this?
Well, as they age, the symptoms can be quite disruptive. So these things develop over time, and it may not be something that all men really think about until it becomes a more severe issue. But the earlier you become aware of these issues and seek action, you can take care of it sooner and avoid some of the downstream complications.
Yes, sir. And what are some of the usual treatment options?
Sure. So most commonly, we recommend lifestyle modifications and often medications, lifestyle modifications and medications to relax the prostate and sometimes to shrink it down. But in a lot of cases, the medications don't work as well for all men, and men often don't want to deal with some of the side effects, which can include dizziness or sexual dysfunction.
Yes, sir.
And that's where other options such as surgical options, such as minimally invasive options come in. And one of the more exciting advancements is aquablation therapy.
Yes, sir. Can you tell me a little bit about that new
Sure. So aquablation is a minimally invasive treatment option for an enlarged prostate. It uses a high-pressure water jet under ultrasound and camera guidance using a robotic-assisted technology to remove the obstructing prostate tissue from the inside. It's a minimally invasive option that usually is done in less than an hour, and most patients go home the following day. So men often are surprised at how quickly they feel better and how quickly they can get back to a normal routine with significantly less symptom bother.
Yes, sir. Is there any other outcomes for patients?
Well, since it's a heat-free treatment, the risk of certain side effects such as sexual dysfunction and urinary incontinence is significantly less than many prior similar options to treat an enlarged prostate.
Yes, sir. And so, you know, for someone who might be dealing with the symptoms but hasn't sought help yet, when should they talk to their doctor?
So, really in any man over the age of 50 who's starting to see changes in their urinary symptoms, this would be a time to begin that conversation.
Yes, sir. And why is it so important to kind of, you know, reach out to your doctor and not let this go on for untreated and undiagnosed for a long time?
Well, as symptoms get worse, you know, there can eventually be bladder damage and other side effects. So the earlier you intervene and find out something is going on, the more likely it is to get symptom relief without some of the unwarranted side effects.
Yes, sir. And where can people learn more about this?
Well, if you go to our website, which is uthealtheasttexas.com, and simply search for BPH, the aquablation therapy information is present there, and we're proud to be the first to offer that here to the East Texas area.
Yes, sir. And what does it mean to be able to offer that to the East Texas community?
Well, it's meaningful to us as both surgeons and as clinicians, because what we're doing is trying to bring state-of-the-art technology to East Texas that will be able to serve not just our current patients, but the wider community at large, and especially in advance like this that is becoming one of the closest options we've ever seen to a one-size-fits-all treatment for enlarged prostate.
Yes, sir. Well, thank you so much for coming in and telling us all about it.
Of course. Thank you so much for having me.
Yes, sir. For more information, go to the website right there on your screen.